The majority of people with endometriosis have some degree of adenomyosis, and this applies even more for people with fertility-related problems because sometimes the adenomyosis takes priority over the endometriosis when it comes to implantation failure. This is something that people need to be aware of. Let me give you an example. Okay, so this is an MRI, and you can see here that this is the uterus here, and you see that the uterus is kind of like a ball, and you can see the lining is making kind of an S movement, and it's asymmetric. You see those little dots and thickness. Yeah, this is an example of an adenomyotic uterus. There's also some endometriosis here. There's a nodule on the bowel, but I think that we need to be aware of the two problems. And this is particularly true for fertility. And we do have a new technology for adenomyosis. It's a form of focal destruction utilizing microwave energy. Dr. Ceccaroni and I have worked on this technology. We have a series of cases with RFI, but it's a very similar technology, and we have data. So I think it's very important to have the experience, to have the data, and so if you have fertility-related problems or pain with adenomyosis and endometriosis, the combined technology is probably the way that it should be approached in order to avoid a hysterectomy.